just a little introduction of myself. My name is Louise Taylor. I'm a business intelligence partner with NHS Dorset, which is part of the Dorset Intelligence and Insight Service, the DICE, if anyone's heard of it. I'm here as part of Dorset. We were one of the early adopters of the National Competency Framework, implementing it within our team with the ambition to roll it out across the wider ICS, across the system. I'm also the AFA South Branch lead, so again supporting the National Competency Framework and the professional registration through AFA. But we're here to introduce Huw. Huw's from Davies Furlong Consulting. He's been involved right from the start around the design and creation of the National Competency Framework. So it's all about how the standards that are expected of being a data professional in healthcare. During my time of knowing Huw, he's always been that friendly face, supporting our AFA events, all around professionalising our analysts. He's always been very passionate about that recognition and development of our skills as data specialists. And I believe lately he's been referred to as the godfather of the framework, with all his involvement. And more recently, they've been nominated, Huw and the team at NHS England have been nominated for a HSJ Digital Award in Data Literacy, Education and Upskilling. So over to Huw to provide an update of the concept of the framework and how we step towards that professionalisation of our data workforce in health and care.
Wow, thank you, Louise. How do I follow that? Okay. I think I won't say any more other than the successes of the programme has been no small part to the early adopters such as Louise. So that's been fantastic. And I'll stop talking now because I always talk rubbish. So apart from that, so I will just first of all share my screen. And I thought, given that I had presented this probably about 50 times, well, certainly more than 50 times. I'm not quite sure I've got to the 100 yet, but a fair few times. I thought I'd do it in a slightly different way to you today. So the narrative arc will follow that of Great Expectations. So the National Competency in Great Expectations by myself, that's Huw Davies, called Great Expectations, of course, because we developed the National Competency Framework with great expectations, those expectations being of pushing the data profession beyond its current recognition as an admin function to an actual profession in its own right, not taking anything away from admin as a function, but when it takes 3 years just to grasp the basics of a subject as it does with data, I think it's only fair that it is regarded as the profession that it is. So the first of these, well, we kicked off with these looking at the National Competency Framework, and when we started this 3 years ago, the first thing we needed to do was conduct a landscape review. And as heading for chapter 1 will show, it was indeed a barren and windswept moor. Maybe not the salt flats of Kent, but nonetheless, there wasn't an awful lot of consistency. It came from the backdrop of a number of key legislative movements and reviews and white papers going as far back as the Personal Health and Care Review of 2014, which was the view to 2020, and the 5-year forward view, but the Watchiter review, the TOPOL review, the 2019 long-term plan, and the launching of Analysts for data as a profession, all the way up to, most recently, the Goldacre review, all spelled out the need for promoting data as a profession, and specifically standardizing the skills and expectations of those working within data. So in November 2021, NHS England commissioned AFA to conduct a landscape review. I helped out with that landscape review. I think I probably did about 20 interviews for it. That was fun. Surveyed over 100 analysts, conducted 50 interviews. Over 40 different frameworks were identified as being used. That's ridiculous. 40 different frameworks for the same profession. As a result of that, there was no standardization of skills, processes, or technique. An analyst in one trust will do something completely different to an analyst in another trust. How can the data profession be regarded as a profession if everyone does things differently? Was a question posed by the Goldacre Review. How can it be possible for a profession to leave one organisation to do the same job in another, but have to relearn their skill set? Is something that analysts were asking when trying to move jobs. And how can you accredit a professional standard when there is no agreed standard? This is something that AFA has addressed by creating professional standards, but they're professional standards that you really have to be a member of AFA to have access to follow to an extent. So how can there be something that is nationwide and across the industry? So we'll take Pip's journey next, our protagonist. Davis Furlong won the contract to complete the Alpha development in October 2021. The landscape review must have been 12 months before. I was fiddling around with the dates earlier. And yes, sorry, that is me as Thanos at the bottom. We also won the subsequent contract to run the beta development and led on the beta 2, why we called it beta 2, I don't know, gamma development of the ancillary frameworks. We led that all the way up until the launch of the National Competency Framework in October. Now, the methodology, it was quite held within itself, really, because the framework needed to be by the data community for the data community. So everything needs to be led by the data profession itself. So it was a question of engagement. So how did we do that? Well, we just basically got everyone involved. When I say I led the development of the framework, that may be true. But actually, we had 8 working groups all feeding in ideas of what it meant to act as an analyst at a certain profession, as a data engineer at a certain level, as a data scientist at a certain level of the profession. And as a result, we had 9 different iterations of the framework, each one deliberately improving on the last. I think this isn't the final iteration. It is a working document. It is something that we intend to update on a regular basis the core competencies I can't imagine requiring changing more than every 12 months, but certainly things like specialisms I would anticipate changing every 3 months, because things do change that quickly. Went through 5 different testing phases. That was a huge amount of energy required from everyone who got involved in the testing. And then launched it to 8 early adopters after we went through the testing period. There are now over 20 organisations that are involved in the early adopters, although I'm not quite sure they're early, just maybe a little bit early, 5 minutes to time probably. There were over 400 people involved in providing contributions to the framework, whether that was simply through questionnaire testing or actually being involved in working groups, steering groups. We had 100 organisations, including, and this is an important point to note, local authorities, charities and central government organisation. We worded it quite specifically for health and care, so that it did cover local authorities, so that it did cover charities, it did cover central government organisations and separate care organisations. And actually, it even covers private organisations as well, one of whom was on our testing body. When we came to the end, we conducted the survey, and over 100% of users felt the framework was as good as anything they'd ever used before, or significantly better. So then, the conformity and fitting in phase. How does this framework, which was designed so independently through the use of the data community, fit in with government expectations? Well, ultimately, when structuring it, we had to relay it to the DDAT framework, the Digital Data and Technology Profession Capability Framework. Now, within this job family, there are 4 branches. There's data engineering, performance analysis, data analysis, and data science. Now, as you can see underneath this one, we've got data engineering, data analysis, and data science as part of the National Competency Framework. The need for making the framework apply to all those organizations that use a huge array of technologies that come from data with a vastly different perspective. Even something as closely aligned as a commissioner provider deals with data in a very, very different way. So in stripping out all of those domains and specialisms, we found that the core skills, the underlying skills that show what you need to have in order to be a data analyst or a performance analyst were remarkably similar, such though that actually we found that without any the word's gone, without making it any less powerful, we could combine performance analysis and data analysis and not lose any of the meaning there. So that we ended up with data engineering, data analysis, and data science mapping directly to the DDAT framework. So now that we've fitted in, it's a question of evolution. How has it evolved? Well, this is what we've done. This is the model of the framework. Some of you may well have seen this before. It has changed ever so slightly, but the model is exactly the same. It's just a couple more blue boxes on there. So you'll see at the top there's domains, and at the bottom there are specialisms. The things that we're most interested in to start with, the 3 areas of data engineering, data analysis, and data science competencies: DE 1 to 7, DA 1 to 6, and DS 1 to 6. Now, the 1 to 7 or 1 to 6 are the number of competencies contained within those areas. You'll see that actually there are 5 L levels on the left-hand side. They relate to the practitioner level, as outlined by the Federation of Informatics Professional, L1 being associate practitioner, L2 practitioner, L3 senior practitioner, L4 advanced practitioner, and L5 leading practitioner. And there are no L5s for data engineering and data science, because when we drew this up, actually, when you get to that level of seniority, the actual specifics of conducting data analysis or data engineering blends into the other 3, such that an L5 from data engineering can do an L5 from data science. So we just left it at the one. We've updated it since for future proofing, but that's why that is there. And there's no L1 for data science, because it was regarded that in order to be a data scientist, you must at least be at a practitioner level anyway, i.e. with a background within analysis or engineering, etc. So we've got these core competencies for each of those areas. So you would possess, at say, a L3 level, which is the senior practitioner level, 6 competencies, which have been broken down a little bit further as well, for your underlying skills to conduct the core work of data analysis. This is enriched then with the use of specialisms, be that an analytical process, a specific technology, a reporting. So you may have, for instance, SPC charts. That is a specialism. You may have SQL as a specialism. You may have explicative analysis as a specialism. But that's what would feed into there to flavour the cake, as it were, of core competencies. You'll see on the side there is a greyed out area for leadership competencies and project management competencies. There should be another one there for behavioural competencies. These are what we've developed and have named the ancillary frameworks, which account for things like leadership skills and behavioural skills and working in project skills, which I'll explain shortly, that, again, further enrich the job and make it very, very applicable to every organization. So you've got the core skills which apply to every organization. Now every organization needs to make it relevant to them, and they do that by the addition and subtraction of various different specialisms and other leadership skills, etc. And domains at the top. This has been taken off the framework at the moment because it's a case of evolution. But these cover provider, commissioner, ICS, whatever you want to call them these days, central government, etc. But that's still there to again further enrich the framework profiles. So this rather small text is an example of what the framework looks like. This is for data engineer. It's the first competency and the second competency, and it's broken down into a number of different points which grow as you go along. For an associate practitioner, naturally, it's quite a small description of what communication skills are required. But as you get further up down towards leading practitioner, there needs to be an awful lot more detail in there, such as owning the definition of documentation standards, etc. So you've got the associate practitioner levels across the top. You do have an indicative level, band 3, band 4, band 5, band 6. Please do not hold any weight to the banding level. You may be a band 6 and identify in here as a band 5. That's fine. You get paid for the job you do, not for the skill, not for what you think you can do, or the other way around. You wouldn't pay a consultant neurosurgeon the same rates as a receptionist for working on reception, for example. But it's there because no one in the NHS seems to want to talk about jobs without talking about banding levels, just to give a vague indication as to where you might sit when starting to conduct, for instance, a role profile. You might think, well, I'm a senior practitioner level. Now, which of these things can I do? And then you tick them off or mark them as training needs as appropriate. And as mentioned with that opening page, the core competencies will form the vast majority of your skills base in your model role profile. You may have a dash of leadership, a couple of drops of specialisms with a smattering of behaviours, and maybe a mere hint of working in projects and a waft of domains, just to come up with the complete specificity of your role. So that's how it all pieces together. So you've got the core competencies, and you've got all the other bits that sit alongside it. What does the future look like? Well, it's a very simple, even though I've probably gone through it in quite a complicated way, it's actually a very simple core to work out. All you need to do is go through the list, the area you're at, and tick whether or not you can do those things. Once you can do them, you'll be doing those at the standard that's set in there, and therefore similar to everyone else across the country. And from that, you can leap out into the world of professionalization. How do we do that? Well, for a start, there's professional registration. Now, professional registration to a professional body, requires agreed standards, and those competencies can be linked very clearly with those professional standards. You need universally applicable development framework. Now, that framework can hang again on those competencies. They should be designed around improvements in each of those competency areas, and that's currently a process that we are mapping to at the moment. A number of training providers mapping to various different competencies. I do a lot of training myself, and I've mapped all my training. There is a management toolkit. This is again something which is in the middle of being developed, but you can map everyone within your team, map all their skills through the framework, identify where you've got shortages, identify where you've got surpluses, so that in fact you can go to your neighbouring organisation that may have an inverted version of that surplus and swap people around. Borrow someone to do something that you've got a shortage of, while you lend them someone who's got something you've got in excess of. And ultimately, when you've got that landscape all talking the same language and working together, you can then have a look at excellence. By identifying a number of different routines and different organizations that do things brilliantly, you can map their processes. You can identify what good looks like, so that if ever you're struggling with this particular area, you can look at saying, what is this routine? Have a look. This is how this organization does it. This is how this organization does it. And this is how this organization does it. Say the best three, for example. And you can take those processes and apply them to your area. And the fact that you're building it on a set of agreed core competencies will mean that it is applicable to your area. Yes, there may well be subtle differences. Of course, there will be. But it will enable the sharing of excellence across the whole health and care economy. That's the vision of the future anyway. But what about its utility? How useful is it? Well, you can write personal development plans. You can literally lift off one of the subpoints from the competency framework for under one of the competencies and say, well, that's going in my personal development plan. You can use the phraseology of the competency framework to write job descriptions. No more fumbling around for words or wondering whether this is the right way to put it or that's the right way to put it. It's all there. You can write your job adverts using the competency framework, particularly if there's one or two key areas that leap out as being important. You can use the competency framework to write interview questions. You can plan the development of your team based on the skills that you've got within the team. You can plan succession based on who has the right skills base to take the next step in their careers. You can undergo professional registration by keeping a record of all the evidence you do when you do your training against the framework to present that through your professional registration. You can share the success through what good looks like. You can go through training, continued professional development, reflective practice, all using the framework. And the list is, I wouldn't say limitless, but in terms of the development of the individual and the development of the team and the development of the organization, it's vast. There's the NHS England online tool that is available to be filled in. I was going to put a link on there for that one, but I figured going through that would take, sadly, a bit too much time. But if you do want to do it, I'll go back to it again. Anyone who's a member of Analysts, if you go to the National Competency Framework, in the resources there is the NHS online tool. Alternatively, if you Google, it's on the NHS Government Gateway, National Competency Framework NHS data. You'll find it easily accessible in there, and that is the self-assessment tool and the being developed management tool as well. So, success stories. The early adopters. There's, like I said, we've gone over 20 now. Here are most of the earliest of the adopters, and we've got in the bottom left-hand corner there the great and imperious NHS Dorset. But actually, all these guys came on board early on and really got stuck into the process. NHS Dorset did it differently, for instance, from East Kent, and East Kent did it again very differently to the way the Business Services Authority did it. To put that in it, for example, I went to East Kent and did their induction to the workshop, and within 2 months of having been there, everyone had a new PDP, which was being reviewed on a 6-weekly basis. I know NHS Dorset have started working small and then working out from a very specific set of job descriptions with analysts, etc., and then out to data engineers. Is that right, Louise?
Yes, that's right. We've started with data engineers and we've expanded to our data scientists at the moment. So,
exciting. But everyone has gone through the implementation process, and we've done it in such a way that it doesn't necessarily take a huge amount of time to do. You can do it as you go. For example, if you're recruiting for someone new, you write a new job description, but you write it using the framework. When you do someone's PDP or you do your PDP, let's be honest, we're entering the season now. why not use the framework to inform it? In fact, it probably saves you time rather than scratching around thinking of ideas. All of these things can be done and be fully implemented over a 12-month period if you do it on that basis. But I'm going to leave some of the exciting stuff there for Louise to talk about once I've finished rambling. Oh, yeah. And as Louise mentioned, NHS England has been nominated for an HSJ Digital Award for digital literacy, education and upskilling for the National Competency for Data Professionals within Health and Care. I nearly fell off my chair when that came through, not because I don't think that it deserves it, but I never even thought that something like that would be a possibility. And I think if we don't win, something's wrong. But then again, I'm biased. Happily ever after? Well, it's only happily ever after if the community now takes the ball and runs with it. We need to use the framework. So on an individual level, use the framework for informing what you do. Request for it to be rolled out in your organization. Push the professionalization agenda. Talk to early adopters. Get the community excited about it. Because ultimately, this was developed by... Okay. NHS England commissioned the development of this framework. And actually, if the community isn't going to take it, then it could be quite understandable to say, fine, we'll just use it in-house then. And that would be a massive resource wasted based on it being something that the wider community can use in the same way as a central government, well, not quite central government, NHS England, but they're very, very different forms of data to most providers, for example. To be able to put things on a level playing field between all the organizations in health and care is invaluable for individuals' career development, for organizational excellence, for improving the baseline week on week. I'm biased, of course I am. I wrote the thing, but actually, this is really the first step in launching the data profession to where it needs to get to, not being reviewed as admin. And thank you all for listening. I hope I haven't sent too many of you to sleep.